Good morning. Bob Ravenscroft, the Vice President for Advancement. It is May 14th for our daily media briefing. Have John here to share routine information that he does, and we want to open up with an announcement and kind of a request from our friends at the Nebraska Community Blood Bank. They are issuing an urgent need for healthy blood and platelet donors. And I want to kind of share some information. It's not just because of the increased need because electives are opened up, but here at Bryan, we treat between 2,100 and 22 trauma patients per year. And May through August are historically our highest months. So we know that that's also going to be a need. But a little bit more background. The blood banks have been struggling through COVID because most of their mobile supply supplies over 50% of the region's blood inventory. And due to COVID-19, the drives have been canceled in March, April, and the early part of May. So they're going to start kicking up some mobile drives, later this month. But even with that, the capacity isn't going to be sufficient to meet the needs of area hospitals, according to them. So what they're going to be doing is they're requesting for us to share information, and we are very happy to do so, that donors can schedule appointments by calling 877-486-9414 or visiting their website at ncbb.org. And they are at their 4 blood centers. They're going to open that up for expanded hours over the weekend. So I know that they're issuing press release statements on this and information on it. But if you guys can help spread the word, or if you are interested in helping, I mean, we've asked for your help on the mask wearings, and this is people are asking for ways to be involved and to help in this situation. Being a blood donor is another way. So look for more information coming from the blood bank on the specifics. But again, they are going to be opening up hours at their 4 sites here locally this weekend, and with the number that was just shared, that's how you can enroll and go in and give blood. Again, some of it's from the electives as hospitals start to try to get back to some semblance of normalcy, but then there are places like us and other hospitals throughout the state that also have trauma patients, and again, it's kind of the high season for blood needs in those areas as well. So if you're looking for ways to help, that's a great way you can do it. Quickly with the stats, our midnight census was 379. And before I get into the other stats, we had some questions from the media about age and gender and so forth, things we've provided in the past. There is a dashboard that is populated now by the county health department that is really getting more and more robust. And the questions that were asked for us around breaking it down by age and sex and gender and race, ethnicity. There's been questions about recovery. That information is populated there. And I know you were asking for Bryan-specific information, but as you can see, as of this morning, it says that there have been 7,200 tests in Lancaster County, and we'll share in a minute, our test count is now up to 6,532. Granted, not all of those are Lancaster County tests, but the vast majority are. So what you're seeing on this dashboard, if you want to go and dig into that, rest assured it's grabbing Bryan's numbers. It's the bulk of those numbers are coming from Bryan. So whatever you're seeing for race, ethnicity, so forth and so on is going to be pretty consistent. So I don't think there's a need for us to provide that level of granularity on a regular basis from Bryan. It's all there. So please use it. It's a great resource, something we look at every day as well. So with that, let's just get right into our counts here at Bryan. We have now administered 6,532 tests. There are 778 positive results, and there's a big number of pending. John will share a little bit of information on that. We have 916 test results pending right now. So, we're expecting the data dump at any time now on a bulk of those, but John will get into that in more detail. So just again, we've administered 6,532 tests, 778 positives, and 916 pending. With that, we'll give you John and then open it up for questions.
Good morning. I thought I would cover the pending number. So the 916 is roughly running us about a 3-day turnaround now from our outside lab. I think we're seeing just more volume in testing, so that turnaround is slowing down a little bit. We continue to work with that lab, and they're trying to use multiple locations to send these tests to. But just as an example, we have tested just shy of 1,000 people in the last 3 days. So that turnaround is ending up about 2.5 to 3 days. Positive COVID patients in-house, we have 25. 13 are from Lancaster County, 12 are from outside. We have 4 patients inside the hospital pending results. We have 8 individuals on ventilators. 3 are from Lancaster County and 5 are from outside of the county. 11 of those individuals are in the intensive care unit. 2 of those individuals are within our progressive care unit and 12 in our general care unit. And as Bob mentioned today with the blood shortage, this is an item that we talked about earlier and said we have to be prepared for this as we open up our elective surgeries. So it's been almost 2 weeks since we opened up the elective surgeries. Things have been going well here in regards to just reopening the surgeries. We had a meeting last night, and our plan was for next week to go from just those elective surgeries that have a 1-night length of stay to elective surgeries that have a 2-day length of stay. And we have made that decision to go ahead and open that up, but we're working very closely with our doctors as well as with the blood bank so that we're taking a look at those procedures that do utilize larger amounts of blood to make sure that we don't stress the system too much. But as Bob mentioned, this is what we can all do to help support these individuals that, one, have been waiting a long time to have some of these surgeries, for the individuals that do have the emergent that need to have surgery, and as we approach and get into the trauma season even more. So it's one of the best things that we could ask for people to step forward and do for us here in the near future. With that, we'll take any questions that people may have via chat.
Not that we've heard. I think their plans are to do that. We were bummed that we missed it. When it does occur, be sure to plug back into our social channels. I know that Brad Coley from our media relations department is going to be on top of the helipad on our Bryan West campus, and we'll have some other shots. But Brad's shots on top of the Bryan West campus might give you your most up close look at a flyover ever. So hopefully it'll get rescheduled. I know a lot of people are looking forward to it. $4,698 of our tests have been done through the drive-through, and that's where the biggest chunk of our pending results are sitting as well.
We've been doing the testing, resulting of the testing for inpatients, for individuals that are coming through our emergency department that are critically ill, and also for our first responders and for healthcare employees. And that supply is relatively limited. And in fact, the other day we were down to about a day supply, and we had another order come in. And we have more capability to send out to our outside labs. We just don't want to deplete that inventory for the more critically ill patients. So that's why we're pretty specific on which ones we'll run in-house right now. If that supply should open up, we would gladly run more in-house because quite honestly, our turnaround's a lot quicker. But right now, we're just at the mercy of our supply chain right now.
We are lined up with folks from our pharmacy to come talk about that as soon as we have them, if they're not for the compassionate care use that's been used for in the past. I know that they're going to be allocated based on who's in beds, who's on a certain level of critical care measurements, but we have not received the big shipment yet, no.